Hello everyone, welcome to a new discussion of a new topic today. We are going to talk about your LE cell preparation. So before we proceed with the preparation of our LE cell, let's talk about SLE first. So SLE or systemic lupus erythematosus is a classic model of autoimmune disease that can affect practically every organ of the body. And this autoimmune disease is characterized by the presence of anti-nuclear antibodies. People with SLE are usually also characterized by the presence of a systemic rheumatic disorder, which is a disease that commonly affects the joints, the connective tissues, and the collagen vascular system of the person. Joint involvement seems to be the most frequently reported manifestation, but aside from this, your SLE can also cause diseases that can affect your kidneys. The peak age of onset is usually between 20 and 40 years old, and women are much more likely to suffer from this disease than men by a margin of approximately 10 to 1. There is a strong association with the human leukocyte antigens DR and DQ when we talk about your SLE, and usually people who suffer from this condition have inherited deficiencies of complement components C1q, C2, and C4. Aside from joint involvement, the next most common signs of SLE are skin manifestations. An erythematous rash may appear on any area of the body that is exposed to ultraviolet light, and people who are suffering from SLE have classic butterfly rash across their nose and cheeks. Clinical signs are extremely diverse, and nonspecific symptoms like fatigue, weight loss, malaise, fever, and anorexia are also experienced by these individuals. There is also deposition of immune complexes in their kidneys. Okay, so these are some of the clinical manifestations of SLE. The first picture here shows you the typical appearance of the butterfly rash that you can see across the nose and cheeks of a person with SLE. And this autoimmune disease could also affect other organs of the body like your lungs, your heart, your kidneys, and your joints. And take note that the clinical manifestations of this disorder could vary from person to person. SLE can also cause your Raynaud's phenomenon or disease, which causes some areas of your body, like your fingers and toes, to feel numb and cold in response to a cold temperature or stress. So next we go to the LE cell. The LE cell is either a normal segmented neutrophil or another phagocytic cell with engulfed homogeneous and swollen nucleus of either a neutrophil or a lymphocyte. It is also an intact neutrophil that has engulfed a homogeneous mass of degenerated nuclear material which displaces the normal nucleus, or the antibody-coated nucleus of another neutrophil. So this is the appearance of your LE cell um, under the microscope when you make a smear from your sample. So notice that your LE cell is actually a neutrophil that has engulfed the nucleus of another neutrophil or lymphocyte. And notice that normally your neutrophil has a segmented or lobulated nucleus, but in this case, your LE cell, since it has already engulfed the nucleus of another cell, the neutrophil's nucleus, original nucleus, is actually been displaced into the periphery of the cell, making room for the engulfed nucleus or extruded nucleus from another neutrophil or lymphocyte. So your LE cell is usually a neutrophilic leukocyte distended by an intracytoplasmic homogeneous red-purple body, giving it a rosette appearance. It's formed due to the presence of your anti-DNA antibodies that are made against your leukocyte proteins in the plasma, which react on lysed leukocytes during incubation after blood collection. Your LE cell may be found in serous fluids of patients with SLE. So, in order for the LE cell to be formed, all the factors necessary for its formation, such as your presence of lupus erythematosus factor, incubation, and trauma to the cell, should exist in vivo. LE cells can form in vivo and in vitro in other body fluids such as your serous and synovial fluids. The following are the requirements for the LE cell to form. First, we have the anti-nuclear antibody or the LE factor, and then we have the nuclear protein material, which comes from other cells like neutrophils or lymphocytes, and third, the actively phagocytic neutrophil. The LE factor, which is one of the requirements for the LE cell formation, is usually IgG in nature. It is an IgG antibody, and it is detected in more than 95% of patients with SLE. This is responsible for the LE cell phenomenon. In the presence of your LE factor, disrupted homogeneous nuclei of lymphocytes and neutrophils are phagocytized by other neutrophils. So these are the following laboratory diagnosis of SLE, or the different methods on how we can determine if a person is suffering from this condition. The first one is the demonstration of the LE cell by using the Buffy coat. Second, detection of your anti-nuclear antibodies, which are actually non-specific for SLE, because there are also other autoimmune disorders wherein you can also detect for the presence of your anti-nuclear antibodies. And third, detection of your anti-phospholipid antibodies, which is found in up to 60% of patients with lupus, but they are associated with several other disease states. So like your anti-nuclear antibodies, your anti-phospholipid antibodies are also non-specific, but would somehow tell you that a person has SLE. Okay, so let's go to the demonstration of LE cell. So earlier I mentioned about different methods on how to determine if a person has SLE, but for this discussion we are going to focus more on the detection or the demonstration of your LE cell using the Buffy coat. So the principle behind this one is that in order for the LE factor, which is present in a patient's plasma with SLE, to lyse the neutrophil nuclei, the cells must first be damaged to allow for liberation of the nuclei from the cells. Also, the LE factor is not able to act upon healthy living white blood cells. That's why we have to destroy the leukocytes. For this reason, glass beads are added to the whole blood, which is then mixed for a period of time in order to damage some of the neutrophils. The blood is then incubated to allow for lysis of the neutrophil nuclei, and the whole blood is centrifuged, and we use the Buffy coat to make smears, stain, and examine for phagocytized nuclear materials we call your LE cells. For this activity, we will be needing a red top tube. Usually, we place the glass beads already inside the test tube, and then we collect the sample from our patient, and then in order to liberate the nucleus from the neutrophils or to damage the white blood cells, we have to actually vigorously shake the tube. Okay, so this is to again help destroy the white blood cells to release the nucleus from the cells. So here are some considerations that we need to take note if we are going to perform LE cell preparation. So our LE cell cannot be found in smears made from peripheral blood or bone marrow immediately after collection. So our LE cell can only develop in vitro, increasing in numbers up to 1.5 to 2 hours. And a 2-hour incubation period is an ideal time for the optimum cell development. Our LE cells are best obtained on heparinized blood samples that are traumatized through exposure to uniformly sized glass beads that are placed inside our test tubes, and clotted or defibrinated blood traumatized by mashing the cloth through a strainer with a mortar and pestle. So there are actually two ways on how to perform your LE cell preparation. So the traumatization provides extruded nuclei for the anti-nuclear antibodies to act upon, causing lysis of the nuclear chromatin. So after we collect the sample using a red top tube with glass beads, we need to vigorously shake the sample to help in liberating the nucleus from our white blood cells. And after that one, we have to incubate the sample for 2 hours. So in that 2 hour incubation, the heavier particles in your sample will settle at the bottom of the tube, and that includes your red blood cells. So our LE cells are usually found in the bottom of the buffy coat layer adjacent to the red cell layer. Since LE cells are heavy due to the fact that they contain two nuclei, that of the ingesting phagocyte and the depolymerized nuclear mass known as your LE body, um, you can find your LE cells in the bottom of your buffy coat, which is important when one is making smears for demonstrating the LE cell phenomenon. Okay, so sometimes in the examination of our peripheral blood smears for LE cells, we can actually see rosette formation. So these are several neutrophils attempting to engulf one nucleus, and it consists of neutrophilic leukocytes surrounding free masses of lysed nuclear material. So according to some sources, rosette formation is the intermediate stage in the formation of your LE cell. Another type of cell that can be seen in the peripheral blood smear is what we call the tart cell. This is otherwise known as your pseudo-LE cell, and it may be confused with your LE cell. So these are actually monocytes with ingested lymphocytes, or monocytes, phagocytizing whole cells or non-homogeneous nuclei. So they are rough and unevenly stained, and they differ from an LE cell because the inclusion retains characteristic nuclear structure. The inclusion is not smooth and has darker staining periphery, and although the presence of your tart cell in peripheral blood smears is not known, or the reason why they are present in the smear is not known, their presence in an LE prep does not signify a positive test for SLE. So this is how your tart cell looks like under the microscope when you try to examine your peripheral blood smears, and when you try to compare your LE cell to your tart cell, the engulf homogeneous structure of the LE cell actually takes up the entirety of the cell, pushing the nucleus to the periphery, whereas for your tart cell, there is so much space, and the engulfed structure is darkly stained, whereas for the LE cell, it's smooth. So your tart cell, it's actually a granulocyte that has engulfed the nucleus of another cell, and the structure of which is still well preserved. So this type of ingested nucleus is known as an artifact in lupus erythematosus cell preparations, and it should not give you the impression that the person is positive for SLE. Okay, so that's it for our last topic for this SEM. Thank you so much for listening to this discussion. If you have any questions, please do not hesitate to ask your teacher. Thank you so much for listening and have a good day.